make it part of your massage sequence. Now I'm going to move on this side. One of the things I want to focus on is the TFL, or the hip flexor muscle. Just stretching it away from the ASIS, the anterior superior iliac spine. Okay, that's pretty good. We did about 4 or 5 strokes, I don't remember. I know that it's more than 3. But one of the things about the quad muscles, I personally don't think it feels really good to press it parallel. At least for me, it's not comfortable. I typically do 45-degree angle, more like cross fiber work. So you see here, I'm just pushing the quads lateral to medial. Can do one, both hands alternating hands, or you can just do more power, more pressure, stuck your hand, and .45 degrees, and it gets sensitive towards the insertion. The origin is pretty fat. There's a lot of muscles there, but there's pretty bony. And at least 3 passes. Now the adductors are pretty sensitive. Maybe you can apply some pressure, but be mindful that you don't want to overly do it. Okay, now we're going to work on the knee a little bit. Gentle pressure along the side. Pretty firm, but not crazy. Now stack thumbs and pushing it up. And back to medial. last area, the peroneals. Three broad passes with my palm. And now a little bit more detailed work. I would just perch on the edge of the massage table and use my stacked thumb. Again, I'm not muscling it just with my, my fingers. I do push it with my body. Sometimes the reason when I do this, some people are pretty turned out, and I'm using my body to help. Instead of going this way, just push a little bit and secure it so it's easier for me to access the peroneals. And it can get pretty intense. Some people, they don't have that much of a reaction, but some people, like when you press right here, halfway to 1/3 down, can get pretty intense. All right, and finish it up with broad, flat stroke. For any each section, I always like to connect all the muscles that we work on together into this nice soft effleurage. Up and down 2 or 3 times, and then that's it. Okay, now you have a different angle. I mean, you can see the adductors and the medial side of the leg as opposed to laterally. And maybe what I did from the other side may not be clear, but it should clarify with this angle. All right. Cream application. Again, make it part of the massage. I'm going to work on the hip flexor on this side. So cross fiber, AB adductors to AD adductor, lateral to medial. Remember, I think I did 3 already, but anyway, I'm going to do another pass. 45-degree cross fiber effleurage on the adductors, and then we'll move to the kneecap. And then last muscle group on the leg, peroneal, at least on the front side. Okay, that's the sequence for the legs from the front.